Pain was only when you had your period?
No, there was pain throughout. This was a different level of pain. I can't express what kind of pain this was. I was depressed. Everyone I told that, I have endometriosis, their first reaction was like, what? Endo what? They couldn't even pronounce it, right?
What actually is endometriosis?
You have tissue growing outside the uterus. When it is shed, it causes inflammation because it is foreign to that surrounding. That becomes a little focus of pain, bleeding, injury, repair all the time, causing scarring.
For 3 months, I was suffering with pain. One doctor actually said to me that the pain is in your head.
The reason why the endometriosis came up in the first place is still not known.
What are the red flags that they should look out for?
Pain gets debilitating enough for you to want to pop pills. That is a red flag.
At this point in time, men usually are taking Viagra, and women, vaginal dryness is going completely unacknowledged, and that is really not a good combination.
That is when my pain increased to the extent that I wanted the surgery.
And sometimes you may find that you don't need surgery. You are treating a symptom and a disease. So you have to see how far you should go.
When you have endometriosis, a lot of doctors say, have a baby.
Doctor said that to me. I was like, okay, where do I find a man now?
Let the doctor tell us. Tell us. Did you know that almost 40% of women suffer from endometriosis, and most of them are still unaware of this disease? And what's shocking is that many women live with it for nearly 7 to 10 years before getting an actual diagnosis. Not because the condition is rare, but because women, we have been taught to normalize pain, ignore it, and to just live with it quietly. In India alone, 43 million women are estimated to be living with endometriosis. Globally, it affects 1 in 10 women of reproductive age. And yet, despite affecting so many women, conversations around it still happen in whispers, hidden behind shame and silence. But debilitating pain is not normal. And today, we find out why. Why it takes this long to understand what endometriosis actually is, what it does to the body, and why it might be happening to you right now. Hello and welcome to All About Her. And today we'll be discussing endometriosis. So our first guest is someone audiences have loved for years and years, not just for her work on screen, but I think also for her honesty, her grace, and her vulnerability off screen. Over the years, she's spoken openly about her health, including her experiences with endometriosis. And I think she's really helped many women feel less alone in their journeys. So please welcome the lovely Shamita Shetty.
Thank you.
Thank you. Thank you for being here. You look lovely.
Thank you, Suri.
Thank you. We also have someone else joining us today. One of the country's most respected names in women's health. With over 35 years of experience, she's a pioneer in endoscopic and laparoscopic gynecological surgery. She's also actively involved in original research on the detection of endometriosis in collaboration with the National Institute for Research in Reproductive Health. So please welcome Dr. Neeta Warty.
Thank you, Soha, for having me here.
Not at all. Are we up to date on the surgeries? Have you done a few more last week? Or today? Maybe.
I think you're being very kind.
No, not at all. I'm so excited to have you. It's hard to get your time. Hard to get your time also, but very hard to get your time.
Yeah.
And I think you're the right person.
This is your first podcast?
Yes.
This is your first any interview?
Oh, yes.
How come?
See? We're really lucky.
Yeah, why have you shied away
Oh my God,
from...
no, this is not about me. This is about endometriosis. Let's get on.
But the important thing is when you're discussing a subject is to have the right voice. And we are fortunate to have someone who's willing to share her journey, who's actually been through endometriosis, has experienced it, and of course has shared in the past very openly from the table and the operating theatre, really, with that glamorous hairnet.
Oh,
very brave.
I tell you.
And then it's very important to have the right expert, I think, also, because there's a lot of information. People get a lot of information from the internet, from social media. And on this podcast, we like to get someone who has the right, an authority on the subject.
I'll try my best.
No, you've already done all the research, this huge book that we have on this table, which you've read. But I wanted to start with you, Shamita, and I wanted to take you back to the hospital bed, if I may.
Okay.
I don't want to dredge up any kind of trauma. But you've, of course, shared this lovely video. I think Shilpa shot it.
Yeah.
And you shared just before the surgery.
Yeah.
And why did you feel the need to make that video or share at that point?
Gosh, for starters, I didn't even know. My sister was just randomly, doing a video.
Yeah.
And I spoke, and after I saw the video, I was like, okay, I should share it. It was the most de-glammed video of me with that net on my head and
But
all of that.
beaming and radiant and lovely.
I don't know about that.
No, yeah.
I was feeling just the opposite inside. But I just felt that at least for someone like me, and I'm somebody who knows a certain amount when it comes to health and fitness and all of that, right? But when it came to endometriosis, or for that matter, even before that, perimenopause, these were things about women I did not know anything about.
Yeah.
This knowledge came to me very late in my life. So, and when I said endometriosis, I'm not joking. Everyone I told that, I have endometriosis, I'm going in for surgery or whatever, their first reaction was like, what? Endo what? They couldn't even pronounce it, right? So I realized that not many people know about this. And when I started reading up, I realized, when I also spoke to some of my friends, I found that there were many people who went through that surgery or went through these problems and obviously opted for, other stuff other than surgery. But nobody really spoke about it.
Yeah.
That's why I wanted to put this out on social media, because I wanted women out there to know that this problem exists and you have to be diagnosed correctly, because I feel like this is something I could have known about maybe 2 or 3 years before I went in for my surgery, which means the pain could have been controlled a little better. Maybe I'm wrong in this, but there were certain things that happened before that suggested I had endometriosis, but I was not even checked correctly.
Yeah. But you're seeing it's only in 2023 that endometriosis has been recognized by the medical community also as a primary disease. So it's not just you. I feel like anyway in India, the whole culture is that as women, we don't speak.
Yeah.
We don't share too much, especially about the things that make us uncomfortable. We don't want to take up too much space. And that's what we're trying to change a little bit on the podcast, is to create awareness. Shamita, you said on camera that I have endometriosis and I don't even know what it is. And my question to you was, how long had you been in pain before you actually got that answer?
I think in my case, I kind of dragged it on because the right diagnosis was obviously not given to me.
Yeah.
And then every time I felt certain symptoms, I felt like, no, but maybe it's normal. Maybe it's normal. And of course, when I went with certain problems to my other gynac, before I was introduced to Dr. Warty, she did everything else, like the pap smear and everything, to check if everything was okay. And when those results came normal, she didn't think to check that it could be something more. It was just left there.
Yeah.
So every time those symptoms came back, I was like, no, but nothing came up last time. So maybe this is normal. It's a part and parcel of being a woman. You know what I mean?
Sure.
And like you rightfully said, we don't really express the pain that we feel inside. Certain things are just normalized with us, whether it's period pain or anything related to our hormones. It's just normalized with women. We're just expected to go through that, right?
Yeah.
So for me, the intensity of pain, it really increased, I think maybe 6 to 8 months before I actually did my surgery. Before that, there wasn't that much pain. It's only when, and I'm somebody who can take a lot of pain.
Yeah.
I've suffered through a lot of injuries.
Yeah.
So when pain woke me up from my sleep, that's when I realized there's a problem.
Yeah.
I think it was after that I came to you, because I realized now my body is telling me something is wrong and I have to try and get answers. And I was also very confused, because I think for me, this happened around a time when I was also learning about perimenopause. So I couldn't understand. There was so much happening with my hormones already. I couldn't understand, was it perimenopause? Is this normal in perimenopause? Or, is there something more?
Yeah, I think even asking the right questions,
Yeah.
you don't know what questions to ask, right? You expect the expert or the doctor to guide you a little bit. And I want to come back to you about the pain, because that's a huge signal, like you said, your body's telling you.
Yeah.
But before that, I thought, again, for some of the people who are watching, Dr. Warty, if I could start with you and ask, what in simple terms, actually is endometriosis? If you could explain it, what is actually happening to the body? What is the body doing?
So endometriosis is when you have a normal cycle. The uterus has a cavity inside and a layer called endometrium. This endometrium prepares to receive a baby every month. That's the function. And then it sheds. Okay. When it sheds, it has a way out. This is the normal cycle every month. Similar to this endometrium, you have tissue growing outside the uterus, which responds to the same hormones. It has no out. Okay, so it gets caught wherever it is. It may be on the ovaries, it may be on the peritoneum, on some organs. So every month, this endometrium-like tissue is shed. When it is shed, it causes inflammation because it is foreign to that surrounding. It is not supposed to be there.
Right.
The body's natural reaction is to compartmentalize so that it doesn't trouble other organs. So, if it is on the ovary starts sticking to the uterus, the rectum is behind it, it starts sticking. So you form this mass with the ovary, the uterus and the rectum. Slowly the tubes come in. So every month there is a cycle of tissue injury and repair, which causes scarring, fibrosis and pain because it develops new blood vessels, new nerves around that. And everything is reacting because it is foreign to the body. The body's tendency is to just get out whatever is not correct, and there is no out.
Does this happen to every woman?
Endometriosis?
The tissue that is building outside.
Correct. So this basically endometriosis is this.
Right.
Now whichever organ it affects, it will respond to it differently.
Right.
So that is how endometriosis is a multidisciplinary, and the symptoms are varied, and that is why it's so confusing.
Doc, when you say shed, you mean wherever it is outside, wherever it's growing outside. When you say shed, you mean it bleeds from there.
Correct. So the endometrial layer sheds.
Yeah.
So it is endometrium shedding.
Yes.
And whenever there is an inflammation, the body reacts with neovascularization, neo nerves coming in.
Okay.
So that becomes a little focus of pain, bleeding, injury, repair all the time, causing scarring.
So in layman terms, I mean, of course, this is very, very technical. But if I were to just generally explain to someone without medically using all of these terms, I would say the layer inside the uterus that generally sheds and we get our period, when it goes backwards through the fallopian tubes outside, it kind of latches on to maybe organs or whatever, and then it grows there every month. The cycle that is happening inside whatever the uterus, the period and everything, it's growing outside also, it's bleeding outside also. Right?
True. So, this was the theory that we believed in earlier. It's called the retrograde menstruation.
Okay.
So, while you're menstruating, there's some tissue going. But now the more and more about endometriosis we learn, this tissue is a little different from this. Which I think we'll come to in some point, where we've been doing research since 2003. And we've identified this endometrium and the outside endometrium differently.
Oh.
So, this is called utopic, that is called ectopic. So it responds to hormones similarly, but it is not exactly the same.
Oh.
But now
so the concepts are changing continuously.
But now also, Dr. Warty, people are saying that this tissue is also being found not just in the pelvic area, but it's also being found to grow almost like cancer cells grow in very remote areas like the brain and the lungs.
True.
So how is that happening?
So that is where this retrograde menstruation theory is false. We have n number of theories about endometriosis. So sometimes it is called a bloodborne, where you have it in the brain, the eye, the lungs, joints, so many places. So then it is called the tissue itself is able to secrete this or make this, or it travels through the bloodstream. And now we have many different genetic and epigenetic factors. So it's getting more and more complicated because there is not one answer to how and why the tissue grows where.
Wow.
Does everyone agree that this is caused by estrogen dominance?
Yeah. It responds to estrogen abundance. So basically, whenever the balance of the hormones is lost, the estrogen is the life giver. It makes a woman a woman.
Right.
It's the most lovely hormone anybody could have, but it has to be balanced with progesterone. It is when this balance is lost and you have abundance of estrogen that you have fibroids, endometrial hyperplasia, endometriosis, all this. So it's sustained by this abundant estrogen.
Right. Shamita, can you tell us what were some of the symptoms that you felt?
Apart from
There was the pain.
There was
and
the
pain was only when you had your period?
No. There was pain throughout. And it was coming in the way of every other activity I was doing in the day, whether it was my workout or anything else I was doing. There was constant lower back pain.
Does it feel like like when you have a bad period cramp, or is it different?
No, it's different. See, although I'm susceptible, I also have a problem with cysts and all of that. For me, my period pain was bearable. I mean, like I said, I can take a lot of pain, right? This was a different level of pain. I can't express what kind of pain this was. It was the most uncomfortable because it was at the back and the front, you know. There was constant lower back pain. That I think for me was probably really difficult to take, because I also have a lower back injury. So this was adding to that.
Yeah.
And that's when I realized, which is what Dr. Warty told me, you said my ovary was stuck to my rectum or something, because the mass was growing, which doctor just said that it sticks to, it grows and it sticks to certain organs and it makes organs
But that would have taken some amount of time for that level of sticking to have happened.
That's what I mean. So before that, I mean, when I used to visit my gynac, it was because there were other things that were happening that I kind of needed to check, like, there's bleeding during intercourse. There's a certain amount of, it's very painful. There were a lot of things that were out of the ordinary for me. And I think I've always been someone who has listened to my body. I can't explain it. It's like the body just talks to you. It tells you when there's something wrong. That's the kind of relationship I've had with my body. And I remember I used to keep telling my trainer, there's something wrong. There's something wrong. And I would just burst into tears. And he couldn't understand what the hell was happening. Suddenly I would sit down and say, no, there's something wrong with my body. Something is just not fitting.
Yeah.
There was sudden weight gain. My lower tummy, I think I must have gained about 4 to 5 kilos. That was the heaviest I've ever been. Lots of water retention. I mean, amongst other little things, like I said, for me it was confusing because there were also perimenopausal
Yes, and these are symptoms that you associate with perimenopause
exactly. Also. So, then when I met Dr. Warty, it was such a normal checkup. She did a normal checkup and, whatever. She understood where the pain was. She knew exactly what she needed to check. She knew exactly what test I needed to do. It wasn't a normal, like other doctors will say, okay, MRI, whatever, right? But within that MRI, there was something else with a dye that they put to check something else. If they see something else.
So
none
did
of
you
these things were
immediately
done.
suspect endometriosis?
So, can I tell you, I must give credit to Shamita as well, because she's a very lovely girl, but she's extremely intelligent and very strong.
Ask a lot of questions.
And very specific. No. You must listen to this, because she knew exactly what she had, what was the trouble, where it was hurting her, and very intelligently gave me everything.
Yeah.
So the first time she came to me, she had something called pelvic inflammatory disease. It's a little infection in the tubes. So we first treated her for that, right? And then I told her, you come back, because now if the pain is persisting, then we have to find out what's underlying this.
Yes.
And that is the time when I actually felt, because initially it was very difficult to do an examination. It was extremely painful. So that was the infection. Once that was taken
even the
care
exam would have been painful.
It was very painful. I can't, I'm telling you, I can't put it
So that
in
would
words.
have been an ultrasound, a transvaginal ultrasound?
No, this is just an examination.
So even that is...
would have been. Then when I examined her the next time, she was so specific about where exactly the pain was. And it was on her ovary, which was stuck, which wouldn't move. So I think this art of taking history, examination, all this with the newer imaging and everything, we are losing.
Yeah.
I think that we need to spend time with the patient, understand where she's coming from, put 2 and 2 together. Examination is such an important finding, because the patient is telling you, it's a dynamic thing between you and the patient.
Yes.
You send her for an ultrasound or you send her for an MRI. She comes back with reports.
Yes.
You're not interacting with her when you're examining her.
Yeah. But that's amazing also, because it's, you say you're in touch with your body. A lot of women are not.
Correct.
Because there's so much that we are doing all the time. And we're
Absolutely.
multitasking, we're looking after families, we're looking after, we're not really prioritizing ourselves, we're not in tune with our bodies.
Absolutely.
And I think that is an important message for everyone is please quieten the noise, listen to your body, because when it's speaking to you through these ways, listen to it.
This is why I said pain is there for a reason.
Yes.
You have to take that time out and listen to that voice inside that. And it always tells you, the body will always tell you when there is a problem.
Yeah. You know, I wanted to touch a little bit, and I'll ask the both of you about the cultural conditioning that we have to normalize our pain. One is Dr. Warty, because a lot of people come to you. Do you feel that exists still, that women are normalizing their pain, whether it's, PCOS or whether it's endometriosis, whether it's menopause, like the things that trouble them? Is that still
100%. Because, so many times they come to you with complaints like, bloating, nausea, something else. And, when you ask them, how are your periods? Oh, my periods are painful.
Yeah.
But they've been there.
Yeah.
Like how many days? 3-4 days I'm in bed. So that is normal.
Right.
3-4 days I'm in bed is normal.
Right.
Because you've been conditioned like this.
Right. Have you ever felt that you have, suffered in silence in the past also? Like when it comes to your body or your pain? Or have you been someone to just say, no, this doesn't feel right, and I must explore?
I've been that.
Is that a family thing? I feel like all of you are really into
I don't know if that's a family thing.
or a sister thing. At least the two of you seem to be in tune with your bodies.
I don't know. I mean, I can speak for myself, and I can say this is just something that I've always done with myself. I've also unfortunately been told I'm too hyper. There's nothing wrong. I'm just getting too hyper about things and all of that till
dramatic.
Finally, I after pursuing it, I get the answer, and then I have to show them. See, this is what the thing was. Right. But this is the only thing that I feel got stretched on for so long.
Yeah.
Even that pelvic inflammation, I feel it became that because certain things were neglected before that. I feel maybe that infection was there for one thing just led to the next, If you don't treat the problem correctly, it will try to then, affect other areas to get your attention till eventually it gets your attention and then something bigger has developed from the main problem. For me, I think it was just this thing that took me so long.
But I've heard, because I'm also assuming with the estrogen being in excess, other things happen when estrogen is in excess. For me, acne happens. Then also mood swings.
Yes.
Did that affect your mood at all?
I was depressed. I think maybe also because of the pain and everything, that was just kind of adding to things. And imagine living with pain 24/7.
I cannot.
It makes you irritable. It kind of does a lot. It affects you mentally. And I think for women, we are controlled by our hormones. Yeah. So in that sense, I think I would just say it wasn't a very pleasant time for me.
That's pretty much an understatement.
And see, it's not like surgery was the first option for me. Doctor gave me 2 options. I think the first thing doctors opt for, correct me if I'm wrong, is birth control pills because they try to probably sort it on the hormonal level. But then again, I'm a patient. I'm somebody I've never wanted to go on birth control pills.
But there's so much talk about how people should not go on birth control pills.
Exactly, right? So my thinking was a little different. And it was just something I was very averse to. But then when the pain became so much, I actually tried it for a month, I think, in desperation. Because who wants to opt for surgery first, right?
Absolutely.
So the minute it started giving me zits and all that, I was like, no, it can't take away my skin now. No, I'm not doing this, right?
Yeah.
That is when I went in for surgery.
Yes.
But then again, I mean, that's another story because Dr. Warty was not for surgery in the beginning. So then I also went in for another opinion, because, when you're so desperate, there is no clarity of thought sometimes. So then you start looking for answers and you kind of want to justify that little voice inside that is telling you do surgery.
You want validation.
Yeah, you want that, right? So then I went, I met someone else as well. Luckily, that person was, I think, operating in the same hospital, and Dr. Warty found out.
No, you told me.
No, I told you. Yeah. I
Best
told
to
you
come
I'm going
clean.
in. Yeah. I told you I was going in. So then she was like, why are you doing it with that person? This is what I excel in, you know.
Right.
So do it with me only. Now, to be very honest,
It's like, that's what
wait. Let me tell you my side, then you tell me your side. So then I had to choose between the two, right? And for me, obviously, for me, Dr. Warty is like the cuddly bear. Right? She's just somebody who has a lot of compassion.
That's important to the
That
doctor.
is so important. So obviously then I would lean towards her only, right?
I don't know who this other non-cuddly bear was, but...
Yeah, forget that.
it.
Yeah, but so then that's why I went ahead, and I'm so glad that Dr. Warty operated on me, because also for this surgery, I think there are 4 cuts that are given or something. She was kind enough to not give me a cut near my navel. I don't know how she managed that, because who wants that? Firstly, marks don't heal correctly on my body. I have that slight keloid problem. I didn't want another scar next to my, on my stomach.
Yeah.
So everything just sort of fell into place.
No, I think finding the right doctor is hugely important before we come to the surgery. And I know you're dying to say
she's
something.
dying to say something.
Yeah, you can say it now.
No.
Same.
I just, that was the innocence I was talking to her about.
Yeah.
So I have totally told her no surgery at the moment. Let's try this.
You said
She's
let's
not
try
happy.
with the pill.
Yeah.
She's definitely not happy with that. Wants a surgery. And then she sends me a long message. Very sweet. I'm telling you, so innocent that doctor, I've got this and I'm posted for surgery and this. I said, okay, Shamita, please go ahead. If you need anything, let me know. Then I get a message the next day saying, I'm not getting a bed. Can you help me with a bed?
You're like,
Oh, really? I said that?
Then I've arranged a bed.
with another doctor.
And after that...
No, dog, when I said that, you're confusing me with another patient.
Your messages.
Really?
And
We'll just draw up these messages now.
the best part is, then she called me saying, aren't you the expert in this? Then why are you letting me get this surgery done?
Okay, but explain this thought process.
The good thing about perimenopause is
Brain fog?
And you
can
brain
just say,
fog.
I don't
And
remember.
you just don't remember. Because I clearly narrated something else in my... Are you sure I did that, doc? Or was that another patient? Because
And
I
long
swear after
messages
this, I'm
saying
going to
that-
have to go through my messages to see, did I really say that?
Because I think at some point were you maybe saying, I really want the surgery and I expect Dr.
I've booked
Warty
myself
to
a
jump in
surgery.
at any point and say, okay, fine, I will do the surgery. Because you're obviously the expert. Like I say, you're the expert, aren't you? Question mark. But the point is that endometriosis presents differently in different women. This is true.
Yeah.
And you can have a number of symptoms.
Absolutely. So that is why it's difficult to diagnose.
Yes.
Somebody could have ovarian, which is the most important one. 50 to 90% of endometriosis women have more of ovarian. But then endometriosis is there on the peritoneum.
Right.
It is there on the bowel.
Explain what the peritoneum is.
Peritoneum is a layer which covers all the organs and keeps them separate. So the organs glide over each
Right.
other.
Which one did I have?
Your peritoneal, ovarian and
Wonderful.
on the
I'm such a
intestine.
wonderful case.
But I want to try and defend the gynecologist that perhaps Shamita was with.
Yeah.
Why was it missed?
So I'll
Why
tell
was it
you-
not? Why was it not even considered?
So, your body whispers before it screams. The whispers have to be picked up. So, you have to be trained to think of that in every patient who comes to you with pain, because pain, she was very specific, but you could have other symptoms which we've missed. She had bloating. She had lot of other symptoms, change in your diet, the bowel habits.
Yeah,
a little
everything.
bit.
But all these
bloating.
gastrointestinal
Correct. So
things are also
you
symptoms
tend
of
to think of
endometriosis.
irritable bowel. They've already labeled that this is
Yeah.
irritable bowel.
No, but having said that, see, I also have colitis. So it took me a while to kind of understand
Correct, yeah.
what was really, is it my colitis?
Yeah.
Is it this? Is it that? It kind of took me a while for me only to understand.
Yeah, and by the
what
time
was
you go
going
to the
on.
next
Yes.
doctor, the
Yeah.
symptoms are also more
Exactly.
for that doctor to pick it up also.
Right.
Yeah.
And there's also actually such a deep connection between the gut
Yes.
and the rest, our brain and the rest of us.
Oh my
yes.
God, yeah.
You're saying all of this, the
There's a
estrogen
whole-
apparently gets metabolized in the gut.
Yes,
Yes.
there's
Your
a
gut
whole lot of
Yeah. Your serotonin.
research.
serotonin is produced in the gut.
Yeah.
So you have a gut microbiome.
Yes.
And you have a reproductive tract gut microbiome.
Right.
Which have a crosstalk.
Right.
And when there is dysbiosis, that is when the gut microbes change.
Right.
And then you have these cytokines. You
Right.
have the cortisol increasing, which interferes with every little thing.
Yeah.
Right.
So
Yeah.
the estrogen is supposed to be conjugated and excreted by the bowel.
Right.
These microbes will reabsorb them.
Right.
So you have your normal cycle estrogens and you have this reabsorbed estrogen.
Right.
So that is where your estrogen levels go haywire.
But this is why I wanted to
now I
understand, if we try and get to the
understand this,
root cause
Yes.
of endometriosis,
Yes.
why is it that some women get endometriosis in the first place because of this imbalance that takes place? But can you, in simple words, tell us why some people get it and
So
other
there is
people
your
don't?
genetic predilection where you are genetically more prone.
Okay.
Okay, you have it in families. When I get patients with multiple fibroids, endometriosis, I always ask them, is there an aunt or a mother or a sister who has it? And then the epigenetic factors, which are under your control.
Okay.
You know, your diet, your exercise routine, stress, what you go through, sleep.
Does that add
everything.
to?
The
I'm just trying to
chances of developing
understand. Somebody like
endometriosis.
me.
Yeah. Who's covering tick, 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 tick.
I am somebody who is health conscious, heavily into fitness. I take care of my workout. Yes, of course, occasionally I overeat, I indulge in
But it's not
whatever.
practice.
In general, though, I follow a healthy lifestyle. How did it happen to someone like me?
So endometriosis is an enigma. You'll never know why till we go to the root cause, which we are in the process. I think another 8-10 years we
They're
need.
just starting to
But
explore.
stress is a
Stress.
very big factor.
Yes, so I remember around that time, I was going through a lot of stress.
Yeah.
There was something happening in my life that was causing me a lot of stress. And strange enough, that is when my pain increased to the extent that I wanted the surgery.
Right.
So these
So-
are triggers.
Right.
And this was happening for about 6 to 8 months
Yeah.
before my surgery. And the stress kept increasing. My cortisol levels also were
Yeah.
extremely
So-
high.
Yeah.
So I think that must have added to it.
I think because it's nice, I think helpful to try and understand the
Yeah.
root cause. And then because surgery is a big thing, and then, we've talked about the contraceptive pill. I want to come to that just a little bit later in terms of when we're talking about solutions to it, because there's immediately people say contraceptive pill and people are like, I don't want it. And there's a lot of chatter. Some of it might be information, some of it might be misinformation. You can clear that up. But my friend always has a question in terms of, and her question, I think you've already answered it actually, which was, why is it missed? And I think it's because it can be complicated and there are a number of systems that are connected that could be causing this. But what's important as a takeaway is the genetic predisposition.
Yes.
So if, for example, you have someone in your family who already has endometriosis, then you should definitely consider it if you're having some of these symptoms. So, that would be helpful for
So
people
genetics and epigenetics, you have to look at the
to know. And your
environment.
lifestyle, absolutely.
Yeah.
But that generation, who would know if they had endometriosis? It's our generation
Very
that's
true.
finding out about
at least finding
something
out.
like this.
Yeah.
But the disease process also has gone a little very severe in
You think it's
recent
increased
years. Yes,
now?
definitely.
Why?
I think the
Stress
environment
levels?
is responsible. Yeah, stress
Is
levels.
it the food we're eating as well?
Everything, the air you breathe, the food you eat, the water you drink.
And it only affects us and
Packaged
not
food.
men because of our hormones.
Yeah, because it's finally boils down to inflammation. So there are high cortisol levels because of stress. There are high inflammatory markers. Now these inflammatory markers are known to cross the blood-brain barrier, go to the brain and decrease serotonin and dopamine, which are mood elevators. So there's a direct relation to mood.
Yeah.
Yeah.
All these inflammatory markers cause reabsorption of estrogen. So
Yes.
again, you're perpetuating it.
So you're not metabolizing
Yeah.
it, you're not...
So I always say shed, sleep soundly, hydrate well, exercise consistently.
But
and
we're the ones doing it,
eat.
you're the one not doing it.
Very
That's the
true.
thing.
So it's very easy to preach.
Yeah, we were talking off camera. I'm saying, you and I are doing it.
I swear.
But I know someone who isn't. And that's what I want to ask you, because you've been such a fitness conscious person your whole entire life. So especially for you, wasn't it even more frustrating.
It was depressing.
Depressing.
Because no matter what I was doing in the gym, I was gaining weight.
Yeah, I cannot
tell you what it was doing to my mental state of mind.
Health.
And at that time, like I said, I was also starting with this whole, or maybe understanding perimenopause, because I was also getting palpitations.
Yes.
So I was going to a cardiologist to find out what the hell is going on here now.
Yeah.
So
a cardiologist.
I went to, because I would have these weird, my heart rate would increase and suddenly it would decrease. There was this dip happening. I couldn't understand and imagine working out and all this happening.
Yes.
So taking care of my diet, trying to actually diet, and I hate dieting, right?
Because you want to...
Because you're trying to, cut down on calories to see, are you still gaining weight after that or not? Because then you know there is a problem, right?
So you tried all of that also, and
I
that didn't
tried
work.
everything. The bloating was ridiculous. It was just the lower tummy there was something else happening.
Yeah.
And even after the surgery, it took me a while. I think it took me a good 2 years to shed those 5 kilos. It didn't go
immediately.
It didn't.
Dr. Warty, could you summarize for the audience what are the red flags that they should, because we've touched on different symptoms, but for people watching again who are perhaps going undiagnosed at this very point in time, what are the red flags that they should look out for?
So pain definitely is the first marker that we look at, and normal mild cramps during a period is expected. But when the pain gets debilitating enough for you to want to pop pills or lose hours of work, or probably not do the physical exercise that you're doing, that is a red flag. Then there are so many other symptoms which are just vague: fatigue, anxiety, bloating, constipation, diarrhea, urinary frequency, that irritation, you want to pass urine but you're not able to, or bleeding during passing urine.
It's coming back to me now. I'm just like
Headaches. One patient came to me only with fever, but the point was that the fever was cyclical. So anything which is cyclical.
Okay.
So probably that was her body reacting to the inflammation. Yeah. And then when I asked, because you have to ask pointed questions to know what else is happening in the body.
Yes.
So a lot of things: headaches, fever, like I told you, shoulder pain if you have diaphragmatic endometriosis, cough.
Wow, is that
you could have cough because of lung endometriosis.
Yes, exactly. Because
also,
the migraines also happen cyclically, because it's the tissue that is in the brain that is again developing during that time of the month, and then you get pain.
That's crazy.
Then we have an entity called scar endometriosis. So you could have endometriosis in a cesarean scar or an episiotomy scar post-delivery. So few years after the cesarean or after that, you suddenly start seeing a bulge, or in the umbilicus where you had a previous surgery. It will start, and every month, the key to it is cyclical to begin with, till it becomes severe enough to spill over in the cycle.
Like it did with Shamita, and then she was feeling it constantly.
I
wanted to also touch on the chronic inflammation and the chronic pain, what that actually does to your body over time.
I think that is the worst, because when you're in excruciating pain, you'll go and find a solution. But that chronic pain, you tell your body that, oh, it's okay.
Yes.
This is what I have to deal with.
Yes.
And the chronic pain, first you stop doing your exercise, then you stop interacting with your peers, then you become anxious, you isolate yourself. So that is something which is changing your whole personality. The other thing that chronic pain does on a pathological basis is that the nerve endings are stimulated. And they get stripped over time with a constant assault of these inflammatory markers like cytokines. So the nerve gets sensitized. That means earlier, if it needed 4x kind of pain to elicit that pain response, now at 1x also you'll have that severe pain. So the nerves start remembering the pain. So that is why the symptoms sometimes persist even after the lesion is removed. The body has remembered and has a memory of this pain. When somebody has an amputation, unfortunately, you have phantom limb pain. It is something like that. And when it becomes very severe, you actually need neuromodulation. Okay, so this chronicity should not be taken for granted.
And that's why these things should not be ignored for periods of time.
Because even for me, after the surgery also, I was so hyper. The minute I would feel a little bit of pain, I would be like, Doc, has it come back? Has it come back? And then, I would go do all of the scans, the tests again to check if it's come back. So
it is. Just the last question before I come to the scans and the tests, is the one symptom that we touched on, which is the pain during intercourse.
Correct.
Which again, I think most people will not talk about. But why, firstly, how common is that with endometriosis and what causes that?
So normally, the apex of the vagina has all these organs, the intestine, the cervix, the uterus, the bladder. During intimacy, the vagina gets stretched.
Yeah.
Normally, these organs would slide over each other and you wouldn't realize. But when there is inflammation and what we've talked about, tissue injury repair, scarring, fibrosis, which is painful. So when you hit that, the organs don't slide, they're there. And that is where your pain, nerve endings and all cause excruciating pain. So the moment something which has to be a pleasure becomes so bad a pain, the body anticipates pain. So the next time that girl is trying, she is anticipating pain and holding clenching, which makes the muscles tense. It's difficult to penetrate. This keeps happening again and again, and the muscles slowly start having a high tenseness so that also causes more pain.
Right.
And then the estrogen, which is supposed to be an anti-estrogenic medicine, causes less lubrication and a dry vagina. So all in all, what is supposed to be in your reproductive years a pleasurable experience that you look forward to is something that you shun. It disturbs interpersonal relationships.
Absolutely, 100%. I'm saying this also is a conversation we have when it comes to perimenopause and vaginal dryness anyway. And we were saying, oh God, at this point in time, men usually are taking Viagra. And women, vaginal dryness is going completely unacknowledged, and that is really not a good combination.
And this is again something that you don't come out with.
No.
That is not the first thing you tell a doctor when you come.
Not. No.
So you have to probe, you have to examine and then find a solution.
But that is why it's when a doctor asks pointed questions as opposed to leaving it on the patient to come up with why and what I'm feeling, then it becomes a little helpful. I wanted to come to the tests and scans that one can do to actually typically diagnose endometriosis. What does one do?
So after you've taken a detailed history, spent enough time, done an examination, then an ultrasound. The ultrasound is beneficial for pelvic endometriosis, and the transvaginal one, I like that when it is a proper doctor who's trained in that, because a patient is part of that examination. He is able to ask the patient whether there is pain here. When he notices a lesion, he's asking. So there is a dialogue happening there. And MRI definitely is absolutely gold standard because you get all the detailed tissue soft markers that you can see. You have to learn
the dye one, no? That's
correct. So with the dye it is always better because see, the endometriosis causes the intestine to stick. Then the endometriosis starts growing on the intestine. Then it starts penetrating the intestine. All that is seen well when you have dye in the rectum and the dye in the vagina. So it's seen very well.
Okay.
The one must know what to pick up in an MRI. The MRI person should know. Also, it will pick up other like shoulder pain causing diaphragmatic endometriosis. So outside the pelvis, MRI is the gold standard.
You do not require laparoscopic surgery to confirm endometriosis, or you still do?
Yeah. So as of now, we don't have a reliable non-invasive marker. 90% I'm saying this is endometriosis. There is a cyst. I cannot take that risk and say, leave that cyst with medication alone. I need a tissue diagnosis for endometriosis yet.
So may I ask, in your case, was that tissue diagnosis the confirmation?
Yes.
So that's what you had to do.
We excised all the endometriotic lesions and they showed endometriosis.
Can we look forward to a time where we don't require invasive?
Yes, very much.
Okay.
So this is where I will proudly say that this is an Indian effort.
Really?
Yeah. So 2003 onwards, I have been integral part of this research, headed by a scientist, Dr. Rahul, from ICMR, the Indian Council, and the National Institute of Reproductive Health, where we have checked that ectopic and utopic endometrium. The research is how many years old now? 2003 we started. So we've identified an immune marker, which can be checked in blood. This scientist has really grown in stature. He's now collaborating. First we had from our center, then we started looking at multiple centers in Bombay, then multiple cities in India, and now he's taken it on the World Forum where a lot of countries around the globe are looking at it. We have an Indian patent on that.
Oh, wonderful.
Okay, but it will take time because this is a solid research.
Right.
What he's doing is he's looking at the Indian diaspora, where how the disease is present in India, Asia, and what are the genetic changes? Otherwise, how do we present? So there's a huge amount. 3,600 patients have been looked at.
So an immune marker will be a blood test?
Yes.
Yeah, I was just going to ask this question. Yeah.
Yeah. So this will come in, but it will still take some time, about maybe 7 years more.
Wow.
And we have some tests coming up, which is a saliva test. Didn't really stand the test of time, but it's still there. It's from France, I think. I'm not very sure. You check the saliva and you get a test. There's a protein marker which has come from Australia. So there are a lot of things. Now we're looking at electroviscerography, where you're checking the viscera.
Yeah. No, but it's nice that much attention
Yeah.
and money is being put into it.
So it is priority research. Endometriosis has been given that tag.
As of 2023.
Yes.
Yeah, better late than never. A little bit I wanted to talk on fertility because, a lot of people say, firstly, if I have endometriosis, I will have trouble conceiving. How true is that fear? Was that a concern for you? The other thing is that they say immediately when you have endometriosis, a lot of doctors say, or is it PCOS? They say, have a baby and that will be the cure.
It is endometriosis. Have a baby, it's a cure. The doctor said that to me. I was like, okay, where do I find a man now?
That's the least of your problems.
She said, have a baby.
But why do they say this? Why is this the
But
cure?
is there a problem conceiving? If there's a problem conceiving, then how does one have a baby? If there is a problem
It's
conceiving?
only going to become more and more difficult to conceive. Let the doctor tell us. Tell us.
So I also belong to the old school of thought.
Yes.
So, in India, everything that any problem will be solved with marriage and baby.
Terrible advice. I just want to say it's not good advice.
So, no, I'm not saying have a baby, but
What doc, you told me have a baby.
because she didn't want to do
I came with one problem, I'm going back with one more problem.
No, that was advice as a senior giving to a
But
junior.
that's also, why do they say have a baby? Like, it's obviously coming from a place of love and knowledge.
No. So, what we want is we don't want the estrogen abundance to act on the tissues. So, that's not correct. Have a baby is not correct. But those months you don't have the estrogen stimulation and those lesions sort of dry off. Okay. But then it is like giving pills for 9 months. That you don't have. It'll again come back. Yeah. So, again, all this depends on how your epigenetics work, how your environment works, how you are taking care of other things. You can't say, doctor, okay, this is the medicine I've taken, this is the surgery you've done, I'm fine.
Yeah.
It's not going to be a bed of roses.
Okay. Did the word fertility come up when you were doing all the endometriosis?
No, I don't think I had any concern also. I didn't think at that time that it could be a problem, to be honest. And it wasn't even a question that I asked.
Yeah.
Can it be a problem?
Yeah. Fertility, a lot of reasons why. Because anatomically, everything is stuck together. So the tube is supposed to go and pick up the egg, place itself when the egg is coming out. The egg may or may not come out because it is trapped. The tube may have endometriosis, which may not pick up the egg. The endometrium is not receptive. And then so many, almost, I think they put the incidence at 80 to 90% of ovaries get affected when there is endometriosis and you form chocolate cysts.
Yes.
So
What are chocolates?
Yeah, that's also one of my questions.
So, somebody must have hated chocolates to
what a name.
call it a chocolate cyst. So chocolate, because the blood and the tissue, over time, the fluid is absorbed, the tissue remains and the blood becomes brown and it looks like gooey chocolate.
Did I have chocolate cysts? Which is even after
Small.
surgery, I was getting those cysts.
No,
It's
those
strange.
are corpus luteum cysts. So
Achha, those
that
are
is
different.
Ovulation. So you were healthily ovulating.
Okay.
Okay.
So the corpus luteum, the chocolate cysts themselves compromise the ovary because they keep expanding and compromising the ovarian tissue. Then the inflammatory markers inside the chocolate cysts will cause a depletion of the eggs and egg quality.
Okay.
So anatomically it is difficult. Chocolate cysts make it difficult. Inflammatory markers. Then there is another kind of endometriosis which is called adenomyosis, which is endometriosis in the muscle of the uterus. Okay, so the muscle is invaded and attacked by endometriotic islands. So obviously it's irritating this thing. It is not normal. It makes the endometrial receptivity lesser when a baby comes in. So you have repeated pregnancy losses with that. Difficult to conceive and then repeated losses. So the uterus has erratic contractions because it's not a normal muscle, not a healthy normal muscle.
I think these are again important things to know when people are trying to conceive, as it could be a possible cause as to why they're not getting pregnant.
Correct. And the interval, so suppose you've done a surgery or you're on these medicines. While you're on the medicines, you can't conceive.
Right.
And once you stop, there is a possibility that it will come back. So you have to have that very intelligent and delicate balance between the times that you want to conceive.
Yes, that window becomes very important. I wanted to come to the surgery now, Shamita, in terms of what, when you were finally, actually when you decided that you wanted to do the surgery and Dr. Warty volunteered her expert services, what were you feeling about the surgery?
I was nervous. I think the first thing I asked doctor was, can it come back?
Yes.
Because I can't keep cutting myself again and again and, taking this out, right?
And they do say it can come back.
Of course, it can come back. So, but then I think she played a very big part in calming me down and answering all of my questions. And I had a lot of them, right? She really, I think, eased me into the
What
entire
were your main concerns?
process. Will it come back?
Yeah. Because you're putting your body through something.
Yeah.
It should count for something.
Exactly. But I have to say, the recovery, my God, yes, of course, doctor did say, I think 6 weeks, 6 to 8 weeks is what you had told me. My first question to her was, when can I go back into the gym? And she said, I think 4 to 6 weeks you had told me, right? Soha, it took me longer.
Really?
I couldn't understand what was going on. It took me a while for my strength to come back. It took me months.
So this is not a small surgery by any means.
Now, is it because it is the uterus area or what? Because I couldn't understand it, right? Because I remember I had fractured my nose and that too was a surgery, but it didn't take me so long to... Obviously, the anesthesia and all of that, takes away a certain amount of your stamina. That stamina is what you have to work on post your, general anesthesia, I think, does that to the body. But this, I was walking like an old woman for a while. I was walking, stopping, panting. But even after the 6 to 8 weeks, it took me a while for my strength to come back and have the guts to go and do a leg workout.
Yeah.
Especially
the kind of leg workout you would be used to doing.
Yeah. That building of my strength took a very, very long time. This is why I tell you, it took me 2 years for me to lose those 5 kilos. And I didn't think it would take me that long.
So first,
maybe it was just my body. Maybe it's lesser for other people. I don't know.
I'm sure for some people it'll be worse. For some people it'll be better. Everyone's body responds differently.
Each one will respond differently. Plus, she wants a lot more out of her body.
Yes.
She's not like any other person who's
But as we should.
Maybe.
You are exercising.
We should get the best out of our bodies.
Maybe.
Absolutely.
And she's been in this very
so much
conscious
into it,
exercise.
Yeah.
But that's what keeps us going, nice.
Yes,
And it's not just a vanity thing of I want to
It's not that.
It's not. It's your mental health. It's your
Exactly.
physical. It's the endorphins. It's how you feel.
Yeah.
I do it for myself.
Yes, absolutely.
For how I feel.
It's what you are.
It's simple as that. Yeah.
I get you. But for viewers watching, what exactly does that laparoscopic surgery entail? And what you find? What are you removing?
So laparoscopy is under general anesthesia. You first go in, you've done your homework, you know where you're going to find what. And then once you go in, you actually look at stuff. Sometimes there are some findings which are different, so you have to tailor that surgery. Every surgery would be different. Some people would have more of ovarian endometriosis. You will have to remove the cyst wall. Again, now when you're doing a surgery on a girl who's very young and you're doing a surgery on a 40 to 44-year-old who's finished childbearing, you would be more delicate with the ovary, sometimes taking a chance of recurrence, but not damaging her eggs.
Right.
Whereas when you're doing it a little later, when she's finished, you would be more aggressive, with recurrence being your prime.
Sure.
So then you have to check the peritoneum under the ovaries, remove every possible endometriotic bit. If it's bladder which is involved, then you have to actually cut that much bladder and stitch it up. Intestine will have to be separated. You get all the organs back, the tubes, ovaries, to their respective places. The ureters, those are the pipes that carry urine from the kidney to the bladder, cross this path. So it's a butterfly area which gets involved and they cross. So first you have to dissect and get them to be safe. So you have to see that all organs are safe and only the ones affected are treated. When you come to the intestine, once you've released it from the uterus, it is then that you actually get to know how much of that intestine is involved. Sometimes it is superficial and you can just shave off the tissue. Sometimes if it's a smaller area, you can just punch that area and stitch. if there are multiple lesions in the intestine and deeper, then probably you have to cut and resect. That is the most probably
So this is why
invasive.
you said, when I was going in for surgery, before that I thought this was a small surgery, laparoscopic small surgery. Just before I was wheeled off, she said, I think Shilpa and I generally, asked, how long will the surgery take or whatever.
This was after the happy video?
Yeah, after the happy video. She said, no, this is major surgery.
And action.
I was like, now I understand why it's major, because she just explained that butterfly area or whatever, and so many things connected and all of that. So
it can take, and yours took 3 hours or something.
Apparently,
2.5 hours, I think, because everything, the anesthesia,
so it can take
post,
that and longer.
Yeah.
But it could also be a simple
shorter,
matter of
If
how short?
could be an hour.
Could be an hour.
Yeah.
It seems like, when you're saying it, you have to remove every cell, like how they do
And you have to be very vigilant
surgeries.
because the first surgery is the best surgery.
But is it like malignant tissue? You have to take out...
So it behaves like malignant, though it isn't.
Right.
Also, once you go in, I guess you discover what
what
is.
you have, correct.
But that's why you have to be careful to remove all the tissue, because
Everything.
the tissue will multiply in the way that a malignant tumor does.
Yes.
When does it reach a stage where surgery becomes necessary? Because you were advising Shamita not to have surgery and you were pushing for the pill. So why do people push for the pill? Why is the pill so hated? And yet people push for it.
So, initially if you catch it early enough, where symptoms, so first you treat the symptoms.
And that you thought was the case with Shamita?
Yes. So, no, I knew it wasn't, but you have to, what I do is when you give in medicines, a lot of times you see the disease getting arrested. I'm not talking of deep endometriosis, but superficial, the ovarian cysts shrink, the inflammation dies down. So if you have, say, 2-3 months of this where the inflammation is going, first the patient is comfortable because the pain is taken care of. So that puts her at ease. And then you are looking at the disease. If you have a 7 centimeter cyst or if you have a 2 centimeter cyst when you're operating, aren't you kinder to the ovary? So it also makes the surgery a little less traumatic.
By giving antibiotics before you do any kind of...
So the tissues are calmer, you operate on that. And sometimes you may find that you don't need surgery.
Right.
Okay. You are treating a symptom and a disease. So you have to see how far you should go.
Right.
Okay. And once a surgery is done, it has to be complete. Okay. All said and done, the reason why the endometriosis came up in the first place is still not known and not under our control. So that is why surgery should be done. Like suppose an organ is affected, intestine is affected, bladder or ureters or the kidney is very rarely but do. Then there is no way you're going to wait. But if the intestine is stuck, there is no disease in the intestine and the tissues are getting calmer, why not? So, surgery is not something that should be taken lightly.
No.
It should be done when it is required, definitely, but should not be used at every person who comes with endometriosis.
Right.
And now we have a lot of drugs which are really helpful. Other than the pills, you have a progesterone IUD, which is you put a copper T inside, not a copper T, Mirena, which is progesterone.
That doesn't agree with everyone. No?
Correct, because everybody will not agree with it. So it's not one size fits all.
Yeah.
Each person's because see, for her, pills were not an option at all. And I understand and I respected that because she said, I'm in a profession where I can't afford this.
What was your concern with the side effects of the hormone?
Firstly, I was breaking out with zits every day.
Yeah.
I couldn't understand how to deal with it. There are a lot of other things that were happening that I felt I didn't need to now add to what I was already going through. Like I said, for me, my lower back pain was ridiculously, it was bad, right? But I mean, I also respect the fact that doctor didn't want me to initially go in for surgery. That is the reason why I decided to try the pill. At least now I can say I tried it and it didn't work for me. That's why I went in for this.
Did the pain come down in that month?
No. It didn't.
So that also didn't.
Yeah. And I was seeing a lot of other things that were kind of adding already to me already feeling low because of everything else that was happening. So then that's why I opted for that.
Right.
And I'm also, I think in a way also glad that this happened, because I think once you also went in, you told me there was a little bit here and there, which we probably didn't know before when we did the...
So it wasn't picked up. The deeper ones were not very well picked up.
A couple of things, lifestyle, diet, are those ever suggested instead of hormone therapy and surgery?
So I think by the time a patient comes to us in pain, only lifestyle will not help. They will be complementary and they have to be there.
And what are those things that one...
So like I said, sleep soundly, hydrate well, eat well, because now the gut microbiome is really important. Your endorphins with physical exercise is important.
Yes.
Good amount of sleep. So everything, the basic cycle is dependent on so many hormones. You have estrogen, progesterone, you have the thyroid also contributing, you have the adrenals with cortisol, then you have melatonin, which comes if you sleep well.
I think retarded in my body.
Insulin from the pancreas.
Yes.
So all of these, the body must be such a wonderfully made.
Yeah.
Because there are so many things which have to be placed properly. And you see people having regular periods, babies, everything going, till you hit a roadblock.
Yes.
So there are so many things which the body is managing, and we should look at all these and put them in place. So food, don't packaged food, empty calories, drinks, all those really disturb our body.
So I do have a question.
Yeah,
sorry.
please.
When it comes to hormone replacement therapy and all of that, are we really as advanced in India yet? I mean, do we need to wait for something like this to be to get better here? Because I know a lot of people opt for this abroad.
So hormone replacement therapy is now very routinely looked at for various medical reasons. It's not only for remaining young or looking beautiful. It is basically for your heart health, for your bone health, for your liver health.
Brain health.
So yes, brain fog, yes, absolutely. So it is not that you should shun it. The realization, it has to be used intelligently. So we have all the know-how that we need. Some products are not available, some products are available, some products are available at times and then not. So I think that is something which will be looked at very soon.
The quality of what we get here is still questionable.
I mean, for example, the local vaginal estrogen is not available.
Local vaginal estrogen is available. That's the Premarin or the Avalon gel.
But it's not available in the
Premarin is
market.
not available at the moment.
I'm saying
Avalon
it exists,
is,
but it is not available. And Avalon has a sort of antibacterial.
Correct.
I know a lot about this.
Correct.
It has an antibacterial thing which is not good for me because I'm trying to look after my flora.
So Premarin is really the one which
available?
helps. The pharma industry.
Because it's women. Women are not important.
Because it's not that important.
Women are very
it's not
important.
testosterone.
What the hell?
Not with the president being a woman. We are important.
Let's hope. The most important question is endometriosis coming back. Is a concern. So how did you alleviate Shamita's, like when you asked, will the endometriosis come back?
I think regular tests is what. So I keep checking my hormone levels, and in the middle, my back pain was coming back a little, so I was a little worried. So I repeated a few tests, and that's when we found out there were cysts forming again, and not the chocolate ones, the normal cysts, which were kind of painful.
Right.
So I started homeopathy rather than taking any other. Ayurveda and homeopathy, I think, takes a little longer. But I think I had abused my system so much with allopathy. In the long run, I felt it was better to opt for one of these. That's how I took care of it. Having said that, I still regularly check myself. I do the transvaginal scan sometimes. I do the hormone tests. That's how I keep a check. If there's and if there's something wrong with the levels, the cortisol levels too, then I know, okay, there's something, I'll consult
investigate
a doctor.
further. Again, it reminds me of, when you're in remission from cancer, a lot of people turn to homeopathy then. And, we're going to have a podcast on this a little bit later. But it's a very similar, for somebody who knows nothing, it's sounding very similar to me in terms of the journey.
But that also you have to be very careful, because a lot of homeopathy, they say, has metal, steroid. And I think with Ayurveda, I think there's metal.
Yes, with Ayurveda there's metal.
So you have to really
This is where Dr. Bhatti looks at her nails because she said, this is not my...
This has nothing to do with
I'm a doctor.
I personally take a lot of homeopathy. Dr.
Really?
Phatak, who was the pioneer, was our neighbor. So we've been brought up on homeopathy. But I don't like a doctor who does not give you the name of the medicines and gives you pills.
Yeah.
My objection is only that.
Yeah.
You should
give
know
the
what is in
medicine,
it.
what is given and what.
I guess it's mixed and given.
For all the chronic problems,
Yes.
homeopathy really works well.
Yes.
So all these
But endometriosis is a chronic problem only.
yeah, so we should look at it.
Yeah.
I'm not the expert, so I wouldn't.
Right.
But I just want that when you're giving me something, you give me a name.
Yeah. Makes sense.
So when it comes to something like a chronic disease like endometriosis, where you can't really say there is a cure, what does that mean? I feel like as somebody who has endometriosis, you can say it's not behind you completely. The kind of challenge that is for you at a young stage in your life, like knowing something has to be managed.
I'm
How
very
do you deal with that?
hopeful with what the future will bring. Like Dr. Warty explained to us before, in time, there will be a lot more available to us for diagnosis in terms of medication and all of that. So I'm very hopeful that in time, we probably will just enter a box and it will tell us, okay, you have endometriosis and this is the solution. Or maybe give us a solution before we exit the box in the future with AI and everything coming in. You know what I mean?
True.
Yeah. You're hopeful.
I'm just saying that maybe something really, there'll be a great solution that will come up for this, for our hormones. Because obviously a lot of women are now talking about this.
Yes.
Talking about these hormonal issues.
Yeah.
So I don't think it'll just go unnoticed. I'm
I
sure
think
there's
this
somebody.
podcast itself is a big awareness.
And doctors already doing so much research and working on this for so long.
What
I'm
is the
sure
hope,
there'll be
Dr.
something.
Bhatti? What are you looking forward to?
So once you find out, because now we are looking at the gut microbiome.
Yes.
So very soon, maybe we'll find an answer there.
Yeah.
So anything which is non-invasive, which is microbiome related, you may have. So the moment we find the answer to why is it happening to some women and why not the others, the answer to that question will be.
And doctors are happy to explore alternates like homeopathy or naturopathy and things like that.
I think all the branches of medicine have to be looked at. They are there for a reason.
I want to come a little bit to the gratitude and the fact that, Shamita, you thanked Dr. Neeta Warty, and I think you thanked your GP as well.
Yes. She was the one I first went to.
Dr. Sunita.
Dr. Sunita Banerjee. And she's another one, who will not just give me medication and just then leave me. If that medication is not helping me, she will want to, dive deeper into the issue.
Yeah.
Try to understand what the problem is. I think she was the one who found you.
Yes. So she's an extremely kind lady.
Yeah.
Dr. Banerjee.
Yeah.
So it has to be that the doctor is full of empathy.
I think
Yeah.
so.
Because this is not
These
a
are the
bed of
doctors I
roses.
go to.
Yes.
But to find these doctors, how important is it to have a doctor who
So I
doesn't
feel-
stop?
True, it's not a bed of roses.
important,
But
yeah.
every time you stumble, you have to have that hand.
Yeah.
Who will take you through that, because this is, you'll have to keep tweaking your medicines or tweaking your treatment
Yeah.
whenever you need. So you need to have somebody who understands you and who's ready to walk with you.
Yes.
And what do you because not all doctors are like that. In my own personal experience and your experience, I'm
Yeah.
happy to speak on your behalf.
Yeah.
It's not always like that. So Dr. Warty, for you, what makes you persist where others would have given up?
I think in her case, she helped me.
Yeah. Also the doggedness of the patient.
So no, I have been.
Yeah.
Find the reason.
Yeah. Yeah.
No, but
I remember once going to a doctor when they were diagnosed. I wasn't diagnosed with colitis. This is completely digressing.
Doesn't matter.
But there was this for 3 months I was suffering with pain, and I went from one doctor to the next. One doctor actually said to me that the pain is in your head. Till I found Dr. I think H.G. Desai, a very old doctor,
very good doctor.
in town. Yeah. He found out that I had colitis. He made me go through the colonoscopy and everything. And finally, I suffered for 3 months.
But this is what I'm saying. The fact that
is
somebody tells you
experience.
the pain is in your head is dismissing.
Imagine a doctor actually saying that to me.
Yeah. It's being completely dismissal.
Because we don't have time to take history.
Right.
Listen to be on the same page as her.
Right.
Maybe she's not understanding some symptoms.
Right.
Which she's, and now when the woman is donning so many hats, You are giving a reason for every little thing. I'm tired because I had a lot of guests. I have this presentation to make. I haven't slept. That is
Right.
why I'm fatigued.
Yeah.
I'm anxious because of this. I have pain because of this. So you give a reason for every symptom and not really look at it.
Sure. Just a couple of questions towards the end of this. I wanted to ask firstly, Dr. Warty, to you. If you could just give, again, our audience a checklist, because we like checklists very much. What symptoms should, or means that a woman should walk into a doctor's office today? What are questions that they absolutely must ask a gynecologist?
So I feel don't normalize pain, first of all. All the symptoms that we've been talking, you have to just prioritize yourself.
Yeah.
Look at that back burner. Your health is sitting there. It should not be.
Yeah.
So pain, don't sweep it under the rug. Don't wear it as a badge of normalcy.
Yeah.
You know, the body will whisper before it screams. Listen to every symptom. Put pen to paper.
Yeah.
Write down every symptom. Maybe it takes a month or 2 months because every symptom is not going to be there every day.
Yes.
Once you have that, maybe the answer lies between those lines and your doctor is able to connect these dots.
Yes.
So you have to prioritize yourself, look at everything when you're doing so many things.
Right.
All the symptoms that we've talked about, you know, it may be just 1 or 2 of them that you have. You may not have everything. So look at yourself. It's like, you know, wear your oxygen mask first before you help the others.
Yeah.
One more thing I want to add to this, and I say this going back to what I said before this, if you've put pen to paper and all of that, you've got everything down, you know that the pain is still there, you've explained yourself, the doctor that you go to is not able to diagnose you correctly, is telling you, okay, this is normal, or you know, your reports are not showing anything or whatever, but the pain is still there, take a second opinion.
Yeah.
This is what I would suggest.
Yes.
Because that's how I found the right doctor,
Yes.
you know, and
Yeah.
I was diagnosed correctly.
Yes.
And this happens with a lot of, this happened with this is how I found Neeta Warty.
Yeah.
So, Dr. Neeta Warty. So,
It's okay.
so yeah,
It's more of a
that is my
friendly
suggestion.
relation now. We're
Yeah.
not
Yeah.
doctor-patient
I told you, you're
anymore.
like my cuddly.
And one final question I thought I'd ask you, Shamita, to address people. What is it that you wish that you had known at the age of 25 that you know now?
Oh God, I mean,
connected to your body, not in general. Like,
yeah.
A lot of things.
But when it comes to health, like I said, there were certain things that I didn't know were, it was a natural process for women, like perimenopause, and endometriosis could be a problem.
Yeah.
I had heard about menopause at the age of 25. I didn't know perimenopause existed, right? So if I had better knowledge of what a woman goes through, I would have been able to tackle it better.
Yeah.
It wouldn't have come across, it wouldn't have just hit me the way it did. Even perimenopause hit me badly. I couldn't understand. I thought I was menopausing,
Yeah.
you know, till I was told, no, I'm far from it. I'm perimenopausing.
Right. And it can take 8 years before you
8 to 10 years, apparently.
Yeah.
So, as a woman, understand what's happening in your body, what the natural process is, in natural process of aging, the changes that will naturally happen to you in time with your hormones. Understand how hormones play such a important part in your existence, your being, because like I said, you're controlled by your hormones.
Yes.
I didn't know all this at the age of 25.
Yeah.
And of course, as you grow older, because of the natural changes, because of those hormonal changes, everything that you're doing in the past may not work the same. You will have to keep tweaking it, altering it, you know, but don't give up.
Yeah.
And by that, I mean, when I was suddenly gaining weight because of perimenopause as well, I could have just got frustrated and said, oh, you know, everything I'm doing is not working, and, you know, forget going into the gym. I'm going to put on weight anyway.
Yeah,
Let me just eat. The cortisol levels are high. I just want sugar. Let me just eat sugar, you know. I didn't give up. I kept trying to find things that would now work for my body.
Yeah.
It changes in time.
Yeah.
So just understand your body better.
Yeah.
That is what.
It makes a difference when you're a fighter.
Yes.
Yeah.
I think so.
Yeah.
Because you will be thrown, so many things will be thrown at you all through your
Yeah,
life.
and I think with us, we're just, women are fighters.
Yeah. Yeah.
And we are blessed with
But we're
estrogen,
usually-
so let us enjoy those and look at the problems.
No, that's true. But I'm saying women are fighters, but we're usually fighting for other people. We need to fight for ourselves a little bit.
Very true.
You know?
So
That's
well
so
said.
true.
Yeah. But thank you both. It's really been,
been a-
I think, very important to have this conversation. We've had about 4 or 5 gynecologists on this podcast. We've spoken about a number of issues. And in the comments, which I read religiously, everyone says, please have a podcast on endometriosis because we don't know what's happening. We don't know what to do about it. There's so much misinformation. So thank you both. It's been really an eye-opener. And I think my main takeaway is that, period pain is common, but when your body is signaling to you that this is not normal for you, you know your body, that's when you can really ask for help. So please ask for help. Thank you both.
Thank you.
Thank you
And
for
I must
having
say, we've just touched the tip of the iceberg. Endometriosis is so vast.
It's a apt metaphor. I feel like the iceberg is inside us.
Thank you, Shamita. Thank you, Soha.
Thank
It was
you.
enjoyable.
Thank you, guys. Painful periods are common, but I think suffering in silence should never be normalized. And I think that for me has been the biggest takeaway from today's conversation. I think the more women talk about their health openly, the easier it becomes for others to recognize the signs, to seek help earlier, and to also just feel less alone in their journey. I have to thank Dr. Warty and I have to thank Shamita again for just being so open about your journey, for spreading so much wonderful information, Dr. Warty, with all of us, and for helping us all just understand endometriosis with so much clarity and with so much compassion. And to everyone watching, thank you for being a part of All About Her. Please don't forget to like, share, and subscribe to the channel for more honest conversations around women's health and well-being. Until next time, stay informed, stay healthy, and we will see you soon.